Hello, I'm Ken Murphy and I'm the Managing Director of GP Connections. Risk management, we all talk about it, we've all heard about it, but do we really know exactly what it's all about? We're looking after patient safety, but it also involves your own safety. It also involves your reputational safety, and that can be very important. From a patient perspective, safety, we see the situations on a regular basis where our patient comes in, the mother or the father, and they bring their children with them. While you're consulting with the patient, what are the kids doing? You need to be very careful. They could be climbing the chairs, looking at things that they shouldn't be. Be very careful of your sharps containers. Where are they? Are they out of the reach of the children? There are things that just need to be watched, be careful of, have a look at. Some of the other things that you also need to be very careful of is obviously an aggressive patient. Have you got an escape route? Hopefully you never need to, but be very conscious of where you're sitting, where the patient is sitting. Make sure that if there is a situation arises, can you get out safely? Can you get assistance? Can you get support? A lot of other things involved in regard to risk management. We're also looking about your own personal safety of looking after your own health and well-being, your mental capacity. Unless you're capable of looking after yourself, how can you look after your patients? You need to focus on making sure that you are totally in control with yourself. If you're not, take a break, take that short break and talk with someone about it. There are plenty of people that are there. You need to take advantage of those. Risk management, as I said, is not only about safety, but it's also about reputational safety as well. You need to make sure that you've got processes in place, things like that. Paperwork can be a pain in the butt, but it can also save your butt. You need to have some processes in place for confidentiality. You've all taken patient confidentiality oath, but what about within your practice itself? What about your receptionist? Do they know what to do if someone rings up and says, "Hello, is my wife still there in the waiting room?" You don't know, the receptionist doesn't know whether there are some issues happening on the domestic scene at home, and that person may just be trying to find out exactly where their wife is at the moment. Do you know what to do if a parent rings and says, why did you see my daughter yesterday? You know that you were seeing the daughter about going on the pill, but does the mother know? You need to be very prepared on what you're going to say to the parent. What are you going to say to the family that is really upset about you seeing their child without their permission? Other things that may happen, you need to think about what you need to do in the event of a circumstance. What happens if you've got a 12-month-old that's come in for their immunisations and you find out that you or your practice nurse has just given them the 18-month vaccination by mistake? What do you do? How do you approach the parent? How do you deal with the potential issues and confrontation that you're going to have with the parent? Make sure that the child is okay as well. You need to think about those things before it happens so that you're prepared and ready for such a circumstance. There's so many issues and cases happening throughout Australia at the moment about patient follow-up, referral follow-ups. What systems have you got in place? Have you got a system in place to follow up with that patient that had those tests? Has anyone called them? Has anyone organised an appointment to get them back to see you? You've referred a patient to a specialist. Do you have a system in place to actually check to make sure that the patient did in fact go to see the specialist? Unless you've got a system in place to remind you, you're going to forget those things and regrettably it may be too late. You need to make sure that those policies, that governance and the paperwork is in place just to make sure that you are protecting yourself and the patient. What happens in the situation where you've got one of your patients that comes in, has got a sore back, numbness down the leg, and is there asking you for a workers' compensation certificate? That's fair enough. You find out a couple of days, when he lets it slip a couple of days later, that he actually had that injury working at home. What are you going to do? Do you know what to do? Think about those sorts of things, because those are things that will happen without notice, and you need to be prepared and be ready to answer those situations and deal with them. If you're working rurally in a small practice, your senior doctor, who you respect absolutely, is there. All of a sudden you start to hear rumour or a story about the fact that they've got alcohol on their breath while they're treating patients. What are you going to do? He's your boss, he's your mentor. Who do you talk to? How do you handle it? Once again, they're those things that you need to be prepared for well before the situation arrives, so that you are able to answer it with authority and deal with it without hesitation, to show that you know what you're doing and that you are capable. Risk management is something that has to happen, and it's something you need to be prepared about. And that's what the management part of risk is all about. Thank you.